came across this story and I thought, well, let's talk to Dr. Chris Labos about this because I'd not sort of seen this brought into the conversation on obesity before. Dr. Chris Labos, cardiologist with a degree in epidemiology, and you can hear him here on CJAD 800 every Sunday on weekends with Joanne Vrakas at 7:20 a.m. Dr. Labos, let's get to it. So fatty liver disease, it's not new. We've been talking about that for a while, but I read that it's actually on the rise now with the number of people who are in fact obese. So as obesity rises, so does this disease. So let's try to understand how this works. You're someone who's overweight or obese, and you try to lose weight and you can't. Does that have to do with fatty liver disease?
Well, actually, the other way around. It seems that obesity and insulin resistance, the stuff that happens as we gain weight, the fact that we need more and more insulin to get our blood sugar down to lower levels, that seems biochemical reasons to favor the accumulation of fat in the liver. So fatty liver is a consequence of obesity. It's one of the manifestations of the metabolic syndrome, which is a term that we used to use to define all the things that go along with obesity. So it's more a consequence of the disease, not a cause of it per se.
Would that be then, if you were one of those people then, and you were dealing with this obesity, and you've tried things like Ozempic or Wegovy or any of those, and unable to lose weight, would it be because of fatty liver disease?
I don't think so. What's very interesting is that prior to the advent of these medications, when they came onto the market, the only way to treat fatty liver, which is actually not the official name for it anymore. I'll just throw that in there for anybody who wants to be pedantic about it. It's now called metabolic dysfunction-associated steatotic liver disease.
Of course it is.
Of course it is. Yeah. We still call it fatty liver, but that's the official name for it. But, prior to this, there really was no treatment for this condition. The treatment was, diet, lose weight, do lifestyle modifications. And if you're far enough along that you're starting to get diabetes, treat the diabetes. The advent of these new weight loss medications means that for the first time, there is an actual specific treatment for this because you are trying to get the patient to lose weight, to decrease their insulin resistance, and then that would help the liver normalize or at least forestall the fibrosis that comes with the accumulation of fat. The ultimate solution would be going to something like bariatric surgery. But you would never do this stuff simply because a patient has fatty liver. You would do it to treat the obesity, and then the recovery of the liver would sort of be a happy consequence of that.
I see. Well, do you ever get to a point then when the fatty liver becomes the issue, not the obesity is the issue, and you feel you need to treat that? And if you did, you can't remove a liver. What would you do here?
Right. So it can, in theory, progress. It doesn't progress very often. The vast majority of people who have fatty liver are asymptomatic. They have no symptoms. It's caught just because you've done an ultrasound for some reason and you see that the liver is fatty, that's accumulating fat. Sometimes there's, elevations of the liver enzymes, meaning that there's a little bit of inflammation of the liver, but it's rarely progressed to the point where there is fibrosis, meaning that you're starting to get into irreversible damage of the liver, which would ultimately progress to cirrhosis. You see that with viruses like Hep B, Hep C. You see that with people who abuse alcohol. You don't tend to see it that much with fatty liver. It could happen. And certainly as you're starting to progress along that stage, you might want to become more and more aggressive about the weight loss goals. It's just that only recently do we actually have a mechanism that is not extreme, because before it was either diet and exercise, which is largely ineffective, let's call a spade, or going for bariatric surgery, which would be an extreme reaction. It's only now that you have, maybe we could try these new weight loss medications. They are not approved, strictly speaking, for the treatment of fatty liver, but you could easily justify it to yourself and the government if you were saying, we're doing it to treat the obesity, and we're seeing signs of consequences of obesity in the same way that if you saw high blood pressure or diabetes, you could justify the use of medications in this way.
Okay, well, let me go back to what you said at the beginning, which was, let's say you're going for something like an abdominal ultrasound, and they happen to notice in the course of that you do have fatty liver or beginning to get fatty liver. What do you do at that point? First of all, should you be concerned? You're saying it's asymptomatic to begin with. What would you do if that was the case?
If you had no symptoms and it was caught sort of like by accident because you did a scan for other reasons, I wouldn't be concerned in the sense that I wouldn't worry about it. I would use it as a wake-up call that it's time to, get your life in order, for lack of a better term. So really start exercising, start eating healthier, realize that, it very much is all downhill after 40. So it's really time to sort of tighten things up and make sure that you're not overdoing it in terms of the desserts and the sweets and, eating more fruits and vegetables. So it really is a call for lifestyle interventions as that. I think it scares a lot of people when they hear this. They think that they have cirrhosis or something like that. That's not the case at all. If there is liver dysfunction, you want to make sure that there isn't some underlying thing in there, like they don't have an undiagnosed Hep B or Hep C infection. That would be rare, but it could in theory happen. And I would also use it as an opportunity to talk to people about alcohol, because alcohol, I think unsurprisingly to most people, is not great for your liver. It's not great for your liver directly because alcohol can be damaging to the liver cells, but it's also not great for you in the fact that alcohol has a lot of sugar and a lot of calories in it. And if you're looking to lose weight and be healthier, cutting back on the alcohol will make a difference because, as Tommy Schnurmacher said to me a very long time ago, there's a reason we call it beer belly and not celery belly. There's a lot of calories in alcohol.
I would just ask if I should go back and harp on that point. Say you discover that, right, that fatty liver in that ultrasound examination. You talked about what you can do as a lifestyle change, what you can do with respect to alcohol. Would that be, even if you hadn't considered it at that point, but you get that diagnosis, would you then consider going on something like Ozempic or Wegovy or not?
If you were otherwise a candidate, let's say you do meet the criteria for obesity in terms of your body mass index and you have other issues, but you were very much on the fence about whether you should do it or not, I think that could sort of that could push you one way or the other. So it would be yet another point that the obesity is starting to cause metabolic dysfunction, because there is a term out there called the metabolically healthy obese. So there are people who have obesity but are otherwise medically fine, and there is some debate about whether you should intervene on these people or not. I personally think you should, because you're preventing long-term complications, and even people with obesity but no other problems still have long-term cardiovascular, a higher long-term cardiovascular risk. Mm-hmm. But if you were looking for proof, I think I would use it in the same way that you could use, coronary artery calcium or some of these other ancillary tests to establish that you are higher risk than you otherwise realize. So yeah, I would use that as proof or justification or an incentive to start on therapy potentially.
And would that be a discussion you would have with your GP? For example, look, I discovered this in an ultrasound. I'm not really worried about it. I live a reasonably, healthy lifestyle. Should I go on Wegovy or Ozempic? Is that a discussion to have?
I think it's a very reasonable discussion to have, and if your GP isn't comfortable or isn't experienced with Wegovy, that's when you might have to be referred to a specialist. But the point is, get referred to somebody. I think people are becoming more and more comfortable with these medications as we gain more and more experience, and we have more and more options for them. We already have 2. There's going to be a few more coming down the pipeline. So there are certainly options that were not there, a few years ago, and because Ozempic has at least come off patent, in the very near future, the price is going to come down substantially and is going to make it a lot more affordable for people. We'll see when that actually happens, but it's probably going to be coming pretty soon.
All right. Dr. Labos, appreciate it as always. Thank you so much.
My pleasure.
Take care.
The newest tracks. Let's go. New music. And the next big thing.
Always on the new music first.
Your first place to hear it all.
'Cause you gon' like it, love it, wanna play it twice. Playing now.
iHeart New Music. Your digital station for brand new drops, fresh finds, and tomorrow's bangers.
I think we need something new.
Discover iHeart New Music. Always fresh, always first. Stream now on the free iHeartRadio app.